And more people are now signing up for healthcare in Colorado. Connect for Health Colorado says during the first 2 weeks of this year's open enrollment period, more than 22,000 Coloradans picked up a plan from the state's healthcare marketplace. That's about a third more than this same period last year. So if you need to sign up and you want to make sure you have insurance on January 1st, you need to sign up soon. I recently talked to a Metro State professor who teaches about the healthcare industry to find out what consumers and students need to know about changes in healthcare. Dr. Jeff Helton from Metropolitan State University is joining me here today, and I know you're an associate professor of healthcare management. You educate people who will ultimately work in the healthcare field. What are you telling them right now? There's so much going on in Washington.
Oh, it's a fast-moving environment in healthcare. Healthcare is a business, and that's what I tell my students. It's a hard business because you're trying to run a business, trying to generate a margin to keep your business going while you take care of patients who are sick and injured and may not always have the resources to pay their bills. So it's a tough balancing act.
Yet it's also political right now. So how does that play into what you were teaching our future healthcare leaders, I guess if we can call them that?
Oh, sure. The political environment, certainly if you take out the polarization sort of things, you have a lot of people who have vested interests in trying to preserve the way the healthcare system is now, because healthcare is one of the biggest industries in the United States. It accounts for almost a fifth of all of the gross domestic product of our country. And so a lot of people do well in healthcare, and so they are really kind of pulling to keep things the same.
So we're facing some deadlines here. What is it that people should know right now about their healthcare before we hit this deadline?
Well, December 15th is the big deadline everybody should be worried about here in Colorado, because if you're getting insurance through the Connect for Health Colorado program, you have to have your insurance signed up for by December 15th in order for it to be effective for you on January 1st.
What if you don't meet that deadline?
Then you're going to have to find insurance through your employer. If you have a special circumstance, like an adoption of a child, you have a child, you lose insurance through some other source, then you can get into Connect for Health through a special exception. But otherwise, you'd have to look for insurance through your employer, qualify for Medicaid, or you would be one of those people that were technically violating the Affordable Care Act, which is still the law of the land today.
And could face a fine, which it sounds like a lot of people choose to go that route.
Yes, they do. And part of it is because the fines right now are smaller than the cost of buying healthcare insurance for many people. And so a lot of people will say it's cheaper to pay the fine than to pay the premium.
What do you say to those people who say, I have no understanding of what's happening right now with healthcare? What do you say to them right now? What can they do to protect themselves and their families?
Well, first of all, find a way, if you can, to get insurance. One of the things that we've seen just since passage of the Affordable Care Act is that a lot of people have avoided financial problems just by having health insurance. Prior to the passage of the Affordable Care Act, about half of all bankruptcies in the United States were because of medical debt. So if you can find a way to get there, there are a lot of resources out to help you. Depending on your income, you can get tax credits or premium credits to help pay for that bill. Take a look at trying to get insurance, because since we've had Connect for Health Colorado here, personal bankruptcies associated with healthcare have dropped by over 50%. So it really does kind of help you protect your financial well-being.
And there's been a lot of talk about what's going to happen moving forward. What if the Affordable Care Act goes away? Is there anything we should be thinking about right now before the end of 2017?
Oh, gosh. That's a hard one, because there really isn't a good plan for what happens after the Affordable Care Act. The Republican administration right now, they've just kind of looked at, they've had an eye on repeal without a lot of ideas about what to do to replace. A lot of ideas have been thrown around, but none of them have really stuck. So from a personal standpoint, certainly if you're looking for a job, look for a job where you can get benefits, health insurance benefits in particular. Take a look at what your health care needs are going to be, and perhaps look at some of the plans that are out there through individual markets. You can get a high deductible health plan at a reasonable cost and be able to protect yourself. You'd still have to put a lot of money out of pocket if you actually got sick, but there will be other plans out there that you could get even if the Affordable Care Act plans went away.
So if there is one takeaway for people who are watching this interview, you suggest that people get insurance no matter what.
If they can,
is that what I'm hearing you say?
Yeah, if they can get access to it, I would suggest they do so.
All right, Dr. Jeff Helton from Metropolitan State University, thank you so much for trying to clear the air on this meaty topic. I appreciate it. Thank you so much. Well, we will be right back. Thank you.